For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning. My name is David Campos. I'm a Deputy County Executive, and we are here live with the County of Santa Clara. We are at the administrative building at the Valley Medical Center campus. And we have this morning two incredible individuals who are actually on the ground running our hospitals. It is my honor to introduce to you Paul Lorenz, who is the CEO of the Santa Clara Valley Medical Center, Dr. Meenesh Bhimani, who is the Chief Executive of the O'Connor Hospital. And they're going to talk to us about our hospitals and how they are preparing for this crisis. But let me begin with Paul, and thank you for being here. Can you talk to us about our hospital system? What do you do?
So thank you, David, and good morning, everyone. So again, my name is Paul Lorenz. I'm the Chief Executive Officer for the county's hospitals and clinics. And for most of you that probably do not know this, the County of Santa Clara operates a pretty large and integrated healthcare system. It is the second largest in the state of California. We have approximately 8,500 employees. We have 3 hospitals now. And most of you have probably heard in the news that we acquired O'Connor Hospital and St. Louis Regional Hospital. So we really have become a geographic integrated healthcare system. And in that, I think it's also important for the public to understand that Valley Medical Center has been around for 150 years. O'Connor Hospital, probably for about the same period of time, over 150 years. So these institutions, if you will, healthcare institutions, are truly here to serve the entire community. Our mission as being a public hospital system is to ensure that everyone has access to healthcare. And as you can imagine, particularly during these times, this is rather important. Also to give you some perspective, and this is really important, when we talk about an integrated healthcare system, we're not just talking about the hospitals, we're also talking about outpatient services, primary care, specialty care. These services are available to the entire community, and that's something that we take very great pride in. We are, at Valley Medical Center, a level 1 trauma center for both pediatrics and adults. We actually have a regional burn center that serves the entire Bay Area. And of course, we have a nationally recognized rehabilitation center. So this truly is, once again, a comprehensive healthcare system that I think we should all be proud of. Again, because it serves the entire community, and it is really the public's healthcare system, your healthcare system. I do want to just remind the group also that it was probably less than 13 months ago that we acquired St. Louis Regional Hospital and, of course, O'Connor Hospitals. Those are truly assets of the community. They serve those communities in terms of providing basic healthcare services from emergency room services all the way through to acute care hospital services, as well as some other critical outpatient services such as wound care, et cetera. The other thing that I would add, when we acquired those 2 hospitals, I think everyone understood the geographic importance of those 2 hospitals relative to serving the entire county. What was also important, and I think the public may not know, is collectively, inclusive of St. Louis and O'Connor Hospital, we probably have, during the normal times, about 600 plus emergency room visits. So these are hospitals that truly are there to serve the community, not only in terms of emergency healthcare services, but ongoing acute care services. Today, obviously, I'm joined by Dr. Meenesh Bhimani. He's been with O'Connor Hospital for quite some time as an ER physician. I'm very pleased and proud that we have someone at the helm of O'Connor Hospital. The integration that has occurred over this past 13 months has gone extremely well. As a public hospital system, acquiring 2 community hospitals is quite the undertaking. And what really made the difference were the people within those 2 hospitals, the staff, the nurses, the housekeepers that really bought into the importance of working together to better serve our community. So I'd like to actually ask Dr. Meenesh Bhimani to say a few words about how that integration has gone. And then I think this will really set the stage of why these hospitals are important for our community during this crisis.
Seems almost, thank God, fortuitous that this happened. Dr. Bhimani.
Thank you. Thanks, Paul. As you know, the integration and acquisition was as of March 1st of 2019, and in the initial phases of the integration efforts, it was a tremendous effort made to start to revitalize both O'Connor Hospital and St. Louis Regional Hospital. And this was everything from staff stabilization to facilities upgrades to modernized equipment to physician outreach, and tremendous amount of effort was made to really bring back O'Connor Hospital to the point where we could serve the entire Santa Clara County community. One of the biggest changes that went and occurred last year was the go live of a new electronic medical health record called EPIC or HealthLink, and this went live in August, which was roughly 5 months after the integration. And this one powerful tool allows us to communicate not only with the entire system, but with the county and outlying hospitals as well. So it's really, all these efforts have truly now made us an integrated health delivery system in which we can outreach to the entire community. What that's also done is prepared us for a time like this, a disaster and a crisis that we've come upon now. And it's allowed us to respond not as a hospital, but as a integrated healthcare system. And we've been able to respond to the needs of the county and our community as a whole, as opposed to a single hospital.
Can you, I think that's sort of the question for many folks is, are the hospitals ready? And given what you have gone through in terms of this integration and the incredible system that you have created, can you talk about that? What do you want people to know in terms of how prepared and ready our hospitals are for this crisis?
That's obviously a really good question, and I'm sure a lot of people are wondering where we stand ready relative to our preparedness. I think it's first of all important for me to say to the public that when Dr. Cody in early March, mid-March, announced the social distancing and made it very clear that this was our first step in protecting the public, saving lives, that really didn't make a difference. She also made sure that we understood as a community that that decision to implement social distancing and a shelter in place allowed the healthcare systems in the county to prepare, to get ready for what we anticipate to be a significant demand on a healthcare system. And frankly, it wasn't just the county healthcare system that understood that. It's every hospital in Santa Clara County, from Stanford to the Kaiser hospitals, to the HCA hospitals, El Camino. All of us collectively as a county healthcare system understand that we need time to prepare for something as significant as this. And so that public health order from your public health officer, Dr. Cody, has really made a huge difference. So let me give you some sense of what we have been doing locally relative to our 3 hospitals and the entire enterprise system. Our first priority was to make sure that our patients and our staff were attended to, that they understood what we were heading into, and that we were taking the appropriate measures to protect them. So first of all, for our patients, we did cancel elective surgical cases. We focused our system on those individual patients that required emergent or urgent services from our 3 hospitals. We changed our routine outpatient primary care visits and specialty visits to phone consultation and our telemedicine, which I think all of us can fully appreciate now, given the need for technology around for all of us to social distance. That has made a huge difference for our system. The other thing that has occurred is that the emergency room, if you recall, there were a lot of public notices about making sure you as individuals, if you were having symptoms, influenza-like symptoms, that you first called your healthcare provider and received directions of where to go to get the care that you needed, and not come to our emergency rooms. That has made a huge difference, and I really want to thank the public for understanding the importance of that. I can tell you today, the 3 hospitals, we are down to maybe 33% of our typical volume in our emergency rooms. So at the height I had mentioned, we typically would see around 600 individuals or visits, 650 plus visits in our emergency rooms. We're down to about 150 to 200 visits to our emergency room. Those individuals that are presenting to our emergency room are acutely ill. 23 to 27% of those patients present with influenza-like illnesses. And of those individuals, only about 10 to 15% test positive for COVID. So we really have, on the front end of our healthcare system, been able to get us to a point in which we can be prepared for any surge that may come upon us in this county. The other thing that I think a lot of people are interested in knowing is what is our bed capacity as a healthcare system. Mm-hmm. So prior to this issue that we're dealing with, this emergency we're dealing with, we would typically staff all 3 hospitals to the tune of around 580 beds. Today, we are about 50% of that. And so we have 50% of our beds available that are typically staffed. Of that, only about, give and take in terms of which day we're speaking of, we're only averaging around 10 to 12% of those patients being COVID positive. So we are serving the community even during this crisis in terms of their normal healthcare needs, which is really important. When 85% of our patient population in the hospitals are acutely ill, that are non-COVID, we have to remember that we have much greater needs in this community, while we're really laser focused on our preparedness around COVID. ICU bed capacity, we're only at 70, 80% of our bed capacity. So we still have around 20 to 30% of our ICU bed capacity available. The other thing that the public should appreciate is that we have the ability, given the acquisition of O'Connor and St. Louis Hospital, to increase our surge capacity by another 340 beds, 200 of which would be ICU capable and ready, inclusive of ventilators. So I really want to express to the public that this time that the public health officer has given your public health care system has been invaluable. And with that, we've been able to focus on making sure the staff are ready and prepared, including making sure that we obtain the appropriate PPE equipment and supplies necessary for any demand or surge on our system. But I'd also like to have Dr. Bhimani talk about what he's experienced and what he can provide in terms of the front lines.
And one question that I know that I get asked a lot about, and I know this is something you both care about, is the safety of our staff. So can you talk about that, Dr. Bhimani?
Sure. So we've gone through extraordinary efforts across the enterprise, the 3 hospital system, to ensure the safety of both our patients and our staff. Those efforts include things such as screening every person entering the hospital, staff, patient, physician, maintaining our supplies of PPE so that every staff member has the appropriate PPE at the appropriate time. We've limited our visitors. We have a restrictive visitor policy, and all of these efforts are really aimed at maintaining the safety of our staff as well as our patients and allowing us to provide the care that we can. We've also developed kind of specialized COVID units. So these are hospital-based units along different levels of care, ICU and non-ICU. And we've developed teams that are truly experts in caring for this patient population. We also have a COVID response team. So any needs that come up in the hospital around COVID patients, we have a specialized team that can respond to those needs instantaneously, 24/7. So all of this has really allowed us to create an environment where our staff safety is paramount, and we're able to provide the best care that we can to our patients and their families.
Well, we're grateful to both of you and to the incredible team in all these 3 hospitals. One last word to the residents of the county. I just want to make sure that you have that opportunity to say to all the people that are out there wondering what's going on.
So I have to, first of all, really express my deep appreciation to the staff on the front lines that are caring for not only our COVID positive patients, but also in the hospital caring for all of our patients. They are truly the heroes. And if I was telling my staff the other day, if I can bottle up what's going on in our hospitals as we care for these patients, I know that the public would be very, very proud of how we're caring for our community and our patients. So really a deep appreciation to our staff. And then I want to acknowledge our Board of Supervisors, our County Board of Supervisors, the County Executive Office, and the Emergency Operations Center has done a phenomenal job in supporting this healthcare system. And then to the public, this is a public hospital. I have to say that without your support, we would not be where we are today. So thank you for your continued support.
Dr. Bhimani, you have the last word.
Well, thank you. I want to reiterate what Paul said. I mean, I think our staff has truly risen to this occasion and has been absolutely phenomenal in every way. The other thing is the amount of community outpouring and outreach that we have gotten, the amount of well wishes and donations, and has been tremendous. And it's a testament to how much I think the hospital system means to this community. And I think that outreach that we've received has been really uplifting to our entire staff. So thank you.
Thank you for joining us, and we'll be back tomorrow with our daily briefing.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.